your thoughts?
Well, I didn't understand that last reply at all, but maybe I'm alone in that.
You're not alone.
Right, OK. I think the move is well overdue. It could be not far enough. I agree with you, Michelle, that it does sound discriminatory to the unvaccinated. I think if you want to solve staffing problems in the NHS, it's much more important that you drop the plan to make vaccination mandatory, which is what Javid has at the moment. And it sounds attractive, but the fact is that that will drive thousands of people out of the NHS, perhaps 90,000 if some claims are to be believed, at just the moment when the NHS doesn't need that. So certainly 5 days rather than 7. And can we drop the mandatory vaccination on NHS staff? They need to be persuaded. I've got nothing in common with anti-vaxxers, but they need to be persuaded, not coerced. If they get ill, they should stay at home. Generally, the risks are subsiding, and it's a draconian measure by our health secretary to threaten people's jobs just because they won't get vaccinated.
Indeed. Charlotte?
I mean, I share the view. I'm slightly confused as to why, in this scenario, you treat vaccinated people differently from unvaccinated, because it's based on whether you have COVID and you're infectious at that point. So I don't understand that distinction either. And I also support the move, but I think we do need a further conversation to say we know that this latest variant is far less severe. You know, we know what the hospital data shows us. We are going to have to start living properly with COVID, because we're not going to get to any form of, zero COVID level. And therefore, I think we actually need to have a conversation about whether self-isolation going forward should remain a requirement, or if we need to be moving more towards a model like flu, where we say that, yes, if you're feeling unwell, actually it's probably a good thing people do stay at home for a bit if they're unwell. But forcing people out of the workplace, I had 1 million people out of the workforce last week. That's not sustainable. And it's not just about the public sector, which people always talk about. That is, of course, important. Teachers not being able to teach kids in schools, being forced to stay home, even if they've got kind of, it's a minor impact on them or the health service. But actually, businesses are taking a massive hit at the moment without being able to staff them. So I think we need a much bigger conversation about how we live with this properly.
Indeed. Amy?
Yeah, I would largely agree. Similarly, I think none of us on the panel are medical experts, as you said yourself, Michelle, so I can't speak to the specifics of that distinction between vaccinated and unvaccinated. Perhaps there is a difference. If there isn't, I think I agree with you largely, Charlotte, that we need to be really careful around measures which seem explicitly discriminatory. To your point, James, I don't think that is the right way to encourage people to be vaccinated. I'm 3 times vaccinated. I massively encourage people to be. I don't know that enforcing mandatory vaccination or creating this kind of us and them dynamic is helpful in the longer term. I think, exactly to your point, Charlotte, we are trying to feel our way back to a sense of normal. And I think within that context, continuing to listen to the science, and I think continuing on what has been a frankly kind of first in a lifetime, for me at least, sort of public education programme around science and how we interpret that in the context of policy making, needs to carry on. So, yeah, I think we are kind of gradually feeling our way back. This is a positive step. Similarly, I don't agree that we should be discriminating, largely because I think that's an unhelpful way to move people towards being vaccinated.
Yeah, and I absolutely think this is discrimination, and I'm astonished that more journalists are not pushing the government on these kind of things. People just seem to accept it at face value, and I find it completely bizarre. As I've always said and been consistent in this, it's not about what your vaccination status. I couldn't care less if you've had 3, 1, 2, 0, it's your business. What I care about, and I care passionately about it, is all the coercion that's going on at the moment. And I feel that we're on such a slippery slope, and people do need to be speaking out about this stuff. So I'll be fascinated to know why on earth somebody who's not fully vaccinated, so of course you could still have had a vaccine, by the way, and this perhaps applies to you, but if you're not fully vaccinated, despite negative tests, etc., you still have to self-isolate. And of course, you saw Next, by the way, the retailer Next today, saying that they are the latest business that's not going to pay the unvaccinated for their isolation period. So I'm sorry, but I think it's wrong, and I think that there are questions that need to be answered. Anyway, for time reasons, I will move on.